If someone or something was attempting to seriously injure your loved one or yourself, perhaps even in their life, wouldn't you do everything in your power to protect that person and try and save them? Coronary heart disease led to a sudden heart attack and the death of my father at the age of 38, leaving 4 children under the age of 12 to grow up without a father. According to the Centers for Disease Control, heart disease is a leading cause of death in the United States, killing over 370,000 men and women annually. About 47% of sudden cardiac deaths occur outside a hospital, suggesting many people with heart disease don't act on early warning signs. Heart disease develops when fatty material and other substances form a plaque, which accumulates within the coronary arteries. Eventually, this buildup of plaque will cause a narrowing of the arteries and will either slow down or stop the blood flow to the heart. If left untreated, the plaque buildup in the arteries will block blood flow and oxygen to the heart muscle, resulting in a myocardial infarction, commonly known as a heart attack. Coronary heart disease is a topic that's near and dear to my heart, no pun intended. Not only did my father die at a very young age of heart attack, my sister and brother have also suffered the effects of heart disease at a young age. Our family has a genetic predisposition for developing heart disease at an early age. This is a risk factor that a person cannot change. However, there are many risk factors of developing heart disease that we can change. What are the signs and symptoms of coronary heart disease which can lead to a heart attack? What are the risk factors that may lead to heart disease? And what can you do to help your loved ones or yourself prevent developing coronary heart disease? Symptoms of heart disease may be very noticeable. However, sometimes in the early stages, the symptoms may be vague. Chest pain or chest discomfort is the most common symptom. This pain is the result of the heart not getting enough blood or oxygen. Other symptoms may include neck, jaw, shoulder, upper back, or abdominal discomfort, a feeling of severe indigestion, shortness of breath, left or right arm pain, nausea and vomiting, sweating, lightheadedness, dizziness, or unusual fatigue. According to the National Institutes of Health, there are multiple risk factors that increases your chance of developing coronary artery disease. Some risk factors you cannot control or change, such as family history or heredity, ethnicity, male gender, or increased age. Heredity or having a strong family history increases a person's risk for developing heart disease. Ethnicity also plays a role in increasing a person's risk. African Americans, Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans have an increased risk for developing heart disease due to higher rates of obesity and diabetes. The majority of people who die from heart disease are over 65. Although men are at a greater risk of developing heart disease, older women who have heart attacks are more likely than men to die from them. Managing risk factors that you can control could help you live a longer, healthier life. Some risk factors can be managed, which include hypertension or high blood pressure, elevated cholesterol, diabetes, being overweight, lack of exercise, stress, smoking, and excessive alcohol intake. Know your numbers. Keeping track of and knowing what your blood pressure runs, your cholesterol levels, and for a diabetic, maintaining glucose within a healthy range is very important. High blood pressure causes the heart muscle to thicken, which causes the heart to work harder. This results in the heart not working properly. Too much cholesterol circulating in the blood can slowly build up in the arteries, the heart, and the brain. Cholesterol, along with other substances, can form a plaque that builds up in the arteries, narrowing them, leading to a heart attack or a stroke. You can help to control your high blood pressure, elevated cholesterol, and diabetes through diet, exercise, and taking medications as prescribed by your physician. Keep to a healthy weight by eating healthier foods, portion control, or joining a weight loss program if you need to lose weight. Eat a diet rich in fruits, vegetables, and whole grains. Choose lean proteins like chicken and fish, and low-fat dairy products. Avoid sodium and fats found in fried and processed foods. Exercise at least 30 minutes a day. Chronic stress may contribute to and increase a person's risk of developing heart disease as well. Learn ways to cope with stress through special classes, meditation, or yoga. Smoking raises triglycerides, which is a type of fat in your blood, lowers good cholesterol, damages cells that line the blood vessels, thickens and narrows the blood vessels, and causes clots to form, which can block blood flow to the heart. Limit your alcohol intake. Over time, excessive alcohol use can lead to developing high blood pressure and heart disease. If you smoke, help is available to assist you with quitting. For information on local free stop smoking classes, visit www.louisvillekentucky.gov. Making one small change at a time or quitting a bad habit can decrease your risk factors for developing heart disease. Learning and being familiar with the signs and symptoms of coronary heart disease and managing your risk factors can help you or your loved ones stay healthy and live longer. Patient education about risk factors you can and cannot control, regular physician visits, and taking your medications as prescribed can help reduce your risk of developing coronary heart disease. According to the American Heart Association, knowing the warning signs and early detection of heart disease may save your life or even the life of your loved one. If you're not sure but think you may be having a heart attack, call 911. Minutes matter. Fast action can save someone you love, maybe even your own life.